If I were to choose 3 words that best describe my approach to pediatric dentistry, they would have to be empathy, adaptability, and fun. Fun being a little bit of ironic, because yes, you're at the dentist as a kid, but I myself feel like I can relate to kids, and I like hearing a good joke during treatment from a little patient, and telling a good joke about teeth or flossing, that sort of thing. And we're always trying to find ways to make these procedures just more interactive and communicating with our patient and letting them know that they can tell me how they're doing. And so often we're joking and just trying to have as good a time as we can. It allows us to get through the day a lot faster and enjoy what we do and continue to be passionate for it. And it helps our patients come back and not feel scared to go to the dentist again next time. Adaptability is extremely important, in my opinion, in pediatric dentistry, because every child is going to have a different set of anxieties or things that are going to be difficult for them, such as maybe a really strong gag reflex that they can't control, and you have to adapt and use a different type of bite block or different type of isolation device. You might have to use this other type of filling material that works better if we're, moving around and wiggling. You have to always have good ways of doing everything in dentistry, but given the set of circumstances. And that allows pediatric dentistry to be a little bit more tolerable for the patient. And then empathy is perhaps most important, especially in pediatrics, just because you got to be able to understand that this isn't a kiddo who's poorly behaved or spoiled or entitled or something. They're just terrified. They would rather be home hanging out with their friends or playing some Minecraft, yet they're having to be convinced to get a needle in their mouth and maybe a drill on a tooth, and being able to understand those for us pediatric dentists, and especially important for our assistants that we work with and provide care with, is definitely necessary and needed in a pediatric dental environment.